How we doing? This talks about the foundation of health. The foundation of health is actually what we call posture, or another name for that is spinal stability. So that is having a strong spine. The reason we need to have a good spine, as you know, with chiropractic, is that we're trying to remove stress from the nervous system. But if you have improper curves of the spine due to bad posture or imbalanced musculature, that's going to affect our nervous system just as much as a single misaligned vertebrae. So we need that foundation, because if we're exercising with imbalanced, bad curvatures, we're going to put wear and tear in the joints, we're going to damage the joints. Diet, we're in stress because our posture is bad and we're not upright as we should be. There's stress on the nerves, the organs aren't functioning as well, we're not digesting our food properly, not absorbing things as we should. And if chiropractic wise, if we're so bad, there's so much imbalanced muscle, it's going to be hard to get bones back in place because there's nothing holding them there, so the adjustment won't last, or it'll just be simply impossible to get the bone back into place just because there's so much imbalance involved. So when we don't have a good foundation for the pillars, the structure, which is the roof, the umbrella of health, which protects us from disease, won't be strong enough. So we'll get sick more often, we'll have more issues down the line. We might not even have any trouble now that's apparent to us, but in the future. So just restating, the health is the roof, the umbrella that it protects us from disease and injuries. And the pillars are what makes the roof stable. And our foundation is a strong spine. So it's allowing the pillars to do their job better. Not discounting diet or exercise or chiropractic or anything like that, but we need to have that foundation first. So why is it so important? We stated a little bit, but let's get deeper into that. So we can't fix a problem if we don't know we have one. So we don't know that there's a problem, we can't fix it. So if we don't have any pain, but somebody looks at you and they're like, wow, your posture is really out, something's wrong, there's imbalanced muscle. Maybe you just haven't put the right stress on yourself to notice it yet, but problems can arise down the line. Our body's very good at avoiding issues. It's trying to keep us out of pain, it's trying to keep stress off the nervous system, and the spine can twist and contort. But at the end, something's got to give, something's got to break. So we got to give stability, we got to address the issue before there is an issue. And B here, you can't fix that problem unless you understand its origin and how it's affecting you today. Like I said, even though you may not know it. So what affects the spine affects the spinal cord. The spinal cord is the nerves. They run from your brain stem all the way down, and there's branches coming out from the actual spinal structure of the bones, going to every organ, tissue, muscle in your body. So any stress or direct pressure to the spinal cord, the nerves, could potentially be the cause of any problems and diseases we see today. So the nerves not functioning, whatever target tissue there is that the nerve's going to is not going to function as well, and there's going to be lack of communication from that target tissue to the brain, because the nerve goes both ways. You got afferent signals and efferent signals, in and outs. So how do we know this? So we look at simply what Hippocrates says: look well to the spine for the cause of all disease. And that's what chiropractic is all about. Because any trouble we have, the spine could be the center cause of that. I'm not saying that the organ could be malfunctioning, but what if it was actually the spine? So it's a good place to check because it can affect so many things. So if you keep that spine strong, who knows what you're able to avoid. So various different types of posture and different problems all relate around muscle imbalance. There could be that there's a bone out of place that's causing this sort of malformation, and I'm not denying that genetics don't play a role here. So it's like, yeah, my mother had that hump at the base of her neck, I'm going to have it too. Yes, but at the core of that, there is muscle imbalance. Now, some people do have spinal structure that the bones are shaped, they're more triangular in the front. Juvenile kyphosis is an example of that, where they'll have more of a hump, but that means you have to fight against that more. That's a weakness that you've inherited, that you have to create a strong, stable force to balance out. So if you're really rounded, that means you need to strengthen your back as much as you can. Otherwise, the pectorals will become more tight, the head's going to go more forward, and it's going to increase the curvature even more. So that's just a problem you realize you have to address. It doesn't mean you have to accept that you're going to be like your parents. So we keep talking about imbalance. So we got the elephants on one end of the seesaw and the mouse on the other. So that shows how a dominant muscle is going to pull one way over a weaker muscle, because certain muscles, like I said before, the back muscles, the rhomboid muscles, which pull your shoulder blades back, counteract the motion of your pecs, which pull the shoulders forward. So if one is stronger than the other, it just makes sense that it's going to be naturally that way. So you're going to have a weaker muscle, which is going to become weaker and weaker and weaker over time because it's going to get less activation. And soon it can reach the point where it can even move or do much motion. And then the nerve has trouble working as well. The nerve signal, the brain and the body talking together. Some people don't even know how to activate their core muscles when I'm first teaching them because they've just never done it. So it's like, use those muscles I've never used before in my life. Yes. It's troublesome. And when we have imbalance in the muscular tissue, we're going to have imbalance in the ligamentous tissue, which imbalance in the ligaments happen differently. The muscles get big and bulky, ligaments get hard and rigid. So it's all about trying to support your spine. Why is my body doing this to me, Nate? It's because it's trying to take pressure off the nerves. Like I said, it's going to do whatever it can to do that. So people are like, well, isn't this your job to fix? And yes, my job here is on the left. So we got one hip higher than the other. We got one shoulder higher than the other. The neck's off to one side. I'm going to attempt to correct this side, because these seem like they're involved with one or two, maybe three bones being out of place, rotated. And then we have on the right side this big hump, the thoracic kyphosis. The head is forward. The shoulder and the head should be in line, like in this first picture. And in the other picture, they're not. We should also have the hip in line too. So we got the ear, the shoulder, and the hip one straight line. On the right, none of that's happening. And the areas where there's X's is where there's going to be ligament stress. And those are the areas in this posture type, which I would call upper cross, lower cross syndrome. That's where the ligaments are going to take the hits. And you'll notice that where do a lot of people have disc problems? Down where those X's are, right? And discs you can lump into the ligament category because they are ligamentous tissue. They're not muscular. They don't contract. They are there as a support tissue, a cushion, especially with the discs. So if you're losing range of motion, the discs are hardening. That's when the nerve spaces, these little holes you got in each little part of the spine here, that's where the nerve comes out, and it can be compressed if you're losing the disc height or if there's abnormal curvatures. And then there's arthritis and there's lack of movement. So if you don't have the stamina to maintain proper spinal alignment throughout your day, exercise will only make it worse. You're like, oh, I'm so hunched over, I need to hit the gym. And sometimes, yes, some certain exercises will help you and will correct you. But most people are like, oh, I'm just going to run. And when they start running, they're already tired, so their posture is going to fail even more. And I'll see this with certain exercises a lot of people do, is that they can some of them can almost stand like, look, I can sit up straight when I force it. But then, you put a weight over their head and everything falls apart. The hips sway forwards. You got to cheat to get the weight up. And that's when you can cause yourself some problems. It's about finding the right exercises for you, which we call those corrective exercises. So they're stretching the tight muscles, strengthening the weak, imbalanced muscle, the inhibited muscle. So we got to learn how to counteract the muscle imbalance and keep the curvature from continuing to get worse throughout your life. You need to make your weaknesses, your bad posture, your strengths. And we all have different little things going on. So it's learning to understand your body. You're on this earth. You got this body your whole life. It's not like you can get a new one. So you got to learn about it. You got to understand it. It's not like, I'm telling you to learn to be an auto mechanic. It's like, you fix the car, Nate. I don't understand the car. You fix the car. It's your body, okay? You can get a new car. Can't get a new body, all right? Makes sense? So lack of tone leads to lack of stability. What is tone? And the lack of tone is those inhibited muscles, those weak, overstretched muscles, which sometimes actually they feel like they're tight. It's like, yeah, it's all tight in my back. And I'm like, yeah, well, that's because it's overstretched. It's like a rubber band. It's a band that you just pulled as far as it can go. It's like I can't even get in there because it's so taut. So our body's response is actually a self-defense mechanism called arthritis. So we got a little bit into this. Let's take it a little deeper. So muscle imbalance, when we move or lift without spinal stability, the concentric, the short, tight muscles, the hypertonic muscles are left to do all the work. So those would be the pecs, pulling the shoulders forward. So not only does this create imbalance, but it also creates uneven stress on the joints. A lot of people have rotator cuff injuries or joint spurs in their shoulders and their neck arthritis. It's all from that muscle imbalance. So arthritis is the body's way of stabilizing. The little joke here, Sir Arthur heard a lot. Yes, it does. Arthritis means arthro is joint. Itis is inflammation. And they'll tell you when you go to a normal doctor, unlike me, they're like, oh, you can't see arthritis. And it needs to be on an x-ray. And, even then, it's going to take 10 years to show up. But even in the word arthro and itis, joint inflammation, irritation, I can feel that, yes. And I know if that stays there, you will see it on an x-ray in 10 years. So you can just trust me. Some people are like, oh, is that arthritis, doc? And like, I got to go into this whole 30-minute presentation. Yes and no. Yes and no. How about that? So it's our body's self-defense mechanism. And it's not a natural progression. We're not supposed to get arthritic. The body does it to protect the nerves. But if we have the balance, then we don't need to go down that road. So spinal degeneration is the same as arthritis. Did you know that? And it's not something that happens. And what it is actually the ligament hardening. So when you see those spurs, it's not like this some bony growth like jutting off the bone. Like, why is my body doing that? It's actually that ligament that was there that's hardening. So when the muscles are imbalanced, they are unable to perform their job, which is to support the curves of the spine. So the ligaments are left to do the work. Ligaments have very little blood supply. They do heal. They take longer. Some people like to say spraining an ankle, it takes longer to heal than, sometimes if you break the bone. Just because of the bones have great blood supply. The ligaments do not. The muscles do. The muscles have wonderful blood supply. So when you tear, even a tendon or a ligament that doesn't have the greatest blood supply, it's going to take a long time to heal. And it doesn't have to be like an injury per se. It could be what we call microtrauma. So we're going to get into that. So there's a difference between big injuries or little injuries over time. Arthritis. So the spurs, we went over before, it's actually the ligaments that are hardening. And they're trying to form to protect the nerves. So there's little holes where the nerve roots come out, like we said before, on the other parts of the spine. They're trying to lock this area down. It says losing disc height. There's the disc right between there. And it's like, this goes any farther, that nerve's going to get pinched. It's probably already got some pressure there, but it's going to lock down. It's going to keep you from moving your neck in certain ways that's going to press the nerve. So you're going to have very limited range of motion. So what is the correction here? You got to balance the muscle, but you also got to get any bones that are out of place in line. So that's why you're here at the chiropractor, getting those bones adjusted, getting them in line so your body has a chance to rebalance them. So, and sometimes, you get that bone in line and the curve does change, but that's rare. Most people are chronic, and we'll get into that a little bit more. All right, a little simple analogy here. It's like throwing a ball into the air sometimes when we put a bone back in place, just because it's so bad. There's no balance at all that the bone's just going to go right back out. There's nothing holding it there. Here's a good neck, nice forward curve, and then a bad neck looks like a whiplash injury. So they hit the car, neck flip forward and back, and you had an injury, and this is not right away. Well, yeah, it says right there 15 years. So you're losing disc height. That's why sometimes they'll take an x-ray right after, like, yeah, you're fine. You take that x-ray to a chiropractor, he'll tell you right away that's not fine. And you got you can't even see the holes here where the nerves are supposed to come through. That's not good. So here's a little example of microtrauma. So he's looking at the computer, he's looking at his phone, he's got that hump. He's going to have the same kind of reverse curvature in the neck. It's just taking time. So there was not a major injury that did this. He didn't get in a car accident, but just sitting there, hunched up over there, the rounded back, the increased curve, the forward hand translation, that could be trauma over time. And a lot of people, they have both. They have injuries plus the bad posture. So the texting neck, we're seeing a lot of that today. So we want to have the ear, the shoulder, the hip in line. So when you're working on your phone, pick it up. That's your exercise time. And we're going to get into some of the other symptoms of what bad posture is and what it leads to. It's not about just looking good. It's about having a stable spine and some of the symptoms of that. And I would say that you could literally have any symptom when your spine is affected in a certain way. Like Hippocrates said, look well to the spine for the center of all disease, because so many things are possible when the spine is being affected. Here's just an example. The head's forward. It's because of gravity, the pressure on the head, what that's going to do to your joints and your ligaments there. So yeah, here on the left, anxiety, low energy levels, tendonitis. Why tendonitis? Because the muscles can't work properly. Some are tight, some are overstretched. Increased risk of injury because there's no balance. Headaches because you have tight muscles pulling on the back of your head, or tight muscles pulling in the front. Neck tightness right there. Lower back pain. Why? Imbalanced muscles, stress on the joint. Plantar fasciitis. The hips are forward, so they're putting more weight on the arches of your feet instead of over your ankles, where they should be. And yeah, when you're putting weight over your arches, you're not going to have any arches left. Degeneration of vertebral facets. Arthritis due to the muscular imbalance. Degeneration of the joints. Of course, the same idea as the vertebral facets. Degeneration of joints. Reduced strength. Yeah, you can't have good strong muscles if there's so much imbalance, because even if one muscle is really strong and tight, it's not going to be able to work properly because it doesn't have any balance. It doesn't have any reciprocal inhibition with this other muscle that's supposed to be working with it. Knee pain, etc., etc. And this is just one posture type here. So when it's lined up, you got more strength, you get better sleep, you're breathing better because you're upright, your lungs can expand, and then this other girl, she can't even get air into her lungs just because it's all caved in her chest, and the ribs are going to start fusing that way. And more confidence, when you stand upright, you feel it too. That's what a lot of people talk about. You're upright, you're going to feel better. Part of it's mental, but part of it is you're getting more oxygen, you're more aware, you're more awake. So here's just some arrows I drew. So these arrows are the long, overstretched muscles. So we call that hypotonic, or taut, or lengthened, or eccentric, or weak. Those are all like kind of AKAs for the same issues going on. And the opposite can be hypertonic, tight, short, and concentric, strong. You're like, Nate, I thought the muscles were supposed to be strong. Yes, but we need balance. It's like doing bicep curls all the time. Yeah, those are great, but if that's all you do, yeah, your triceps it's not gonna be able to work at all. It's gonna be overstretched, and even the bicep's gonna have trouble working just because it's got no balance. Because when a muscle pulls one way, the other one has to contract a little bit to prevent that joint from snapping completely off. And if it's tight, you're gonna lead to arthritis in the elbow, or even in the wrist, stuff like that. And so we got a little bit into the tiredness. It's so hard to stand up straight, Nate. You're wasting all your energy trying to stand up straight, but if you're very imbalanced, that's really going to drain you. And a lot of people, you look at people who are always tired, just take a look at their posture. You might notice that they're a little hunched over. They're not the people with the upright posture. It's like you're eating the same food, you're working the same job. Why is one person more tired than the other? So we got to look into that a little bit. It's like when people say it takes more energy to frown than it is to smile. So you can kind of look at it that way if you want. So injuries, I would like to say, just don't happen. I get so many people in. It's like, I didn't do anything. I got out of bed. I picked up a pencil. There was this coin on the floor. I picked it up. I blew a disc. I didn't do anything. It's because that's why I'm saying, just because you're not in pain doesn't mean that there's stuff not going on. And I'm not trying to get you into the chiropractor or steal your money. I'm trying to save you money by not having you blow a disc and get spinal surgery. Doing postural exercises is one of the easiest things to do in the world, and learning how to stand up straight, learning to activate your core. It's a little tricky learning how to deal with yourself, but once you got it, it's cheap. Just do it in your car a little bit, change the way you're at the gym. It's not really like you're adding too much to your life. You're just changing the way you're doing things to prevent these things down the line. So let me read this just a little bit. So yeah, I didn't do anything. It's like nails grating on a chalkboard. When I hear this, the last thing I can do is jump down someone's throat because they're in pain. If you're like, you've never heard this from me before, it's because, yeah, I don't want to add insult to injury by assaulting you verbally for not standing up straight while you're suffering. Okay, that's not what I get up in the morning for. So injuries don't just happen. The body has to become so imbalanced to a point where a simple motion like getting out of the car or picking up a pencil tears joint or ligamentous tissue. Best example I can think of is a balloon slowly filling up in the air. Everyone's surprised when it pops, but it's common sense that if you let it go, it will blow. Should be on a shirt. So a stable spine is not prone to injury. It's like when you were a kid, go on that roller coaster, head's bobbling around. You do that now. Why? Oh, I'm older. No, there's more imbalance. So there's not stability in your neck, and so it's going to get injured more because the ligaments and the joints are taking the hit because the muscle's not there to protect it. All right, so here's some examples, and there's more videos I do on this. It's just a quick one, just between anterior and posterior pelvic tilt, because we all have different posture types. So the guy on the right here, his hamstrings would be tighter, and then vice versa, you know, the back, and then the other guy, the quads would be tighter, and there's other muscles that switch and reverse there, and you can see how that affects the spine a little differently on each one. So they could wind up with a whole set of different problems than the other person. So you have to look at that as well when you're looking into correcting your posture. And there's just another picture on those two. Anterior pelvic tilt is a forward rotation, where posterior is a backwards rotation. And this can happen on one hip over the other too, and that's when you really want to see the chiropractor, because you want to get them working together. But generally, I'll see both hips are usually doing one thing or the other. Both are going anterior, both going posterior. And the problem could be elsewhere too. It could be up in the back. But do you really know how to stand correctly is my question to a lot of people, because like, oh yeah, upright, and then and it's like 99, 100. I'll put it down as 100%. I know this is probably surprising you, but no one knows how to stand up straight. Did I know how to stand? No, I didn't. I didn't understand the stuff. I was in so much pain growing up. I didn't understand it. I'm like, my father's a chiropractor. Why do I have this pain? And I talked to other chiropractors, like, no, you don't need posture. When you get the spine right, the posture just comes. And I've tried every different chiropractor. And I see patients who've been seeing my father for 40 years. They're still hunched up and rounded. And I refuse to believe that's just what happens. So I believe it comes down to muscular imbalance. So it's talking about getting these 4 points in line. Your ankle bone, which is your lateral malleolus, in line with your hip bone, in line with your shoulder, in line with your ear, one straight line, to avoid these issues on the left, because they all come with a great variety of things that are going to give you trouble. And that's not just your spine, that's your hips, your knees, your feet, your ankles, your hands. Get the spine straight first. That's where I feel physical therapy. A lot of people fail in physical therapy. A lot of people fail in chiropractic as well. I'm not saying that physical therapy is bad at all. It's just that you come in for a shoulder issue, they're going to look at the shoulder. They're not going to look at your spine. Some will. I feel like more and more people are getting on this train. They're understanding it. But you got to get the spine right first. And then we can look at the shoulder. Because if you're rounded, heads forward, you work on that shoulder all day, you're not going to solve the issue. And a lot of times, you're doing the corrective exercises with piss poor posture. Yeah, okay. So we got into that one. Off-center hips. We're looking at a lot of the same ideas. A lot of times, chiropractic can help this. We can level the hips. But if it keeps coming out, one hip keeps going higher, it could be what we call a unilateral imbalance. Before we were talking bilateral. So both quads would be tight, or both hamstrings would be tight. So now we could have like one leg is tighter on the outside, or one leg's more tighter on the inside, pulling the hip down, or it could be up in the torso too. So we got to learn to correct those things as well, because sometimes that could be from an injury, or it could be from micro trauma, always using your computer, always leaning one way, working on your mouse. So you got to find the right exercises for you to balance yourself out. A good one for this is like the suitcase carry, which you're carrying one weight on one side to learn to bring balance to yourself. And you'll notice that the weight on one side over the other will be harder. Why is that? Because one is working with the weak muscles that you're not used to. Here we go again. Which leg is taking the weight? Will arthritis develop? Yes, it will. Shoulder higher. Heads turn one way. Will arthritis happen? Yes, it will. So what's the answer here? We fuse the whole spine, right? We get in there, put some Harrington rods. No, why don't we just get this girl adjusted? Why don't we give her some corrective exercises? Do everything we can to balance her out. And yes, you might always have to do these exercises if it's something that's genetic. If she has like a malformed vertebrae that she has to fight against, she can still get herself to a point where she is able to combat these things. All right. So muscle patterning over time. Is it the joints or the muscles? It's both. So physical therapy, chiropractic should be best friends. But I feel it has to deal with the spine. You got to get the posture right first. So we can see areas that'll be affected. Just because it's the leg doesn't mean that's not going to affect your head. Chain reaction. If the shoulder's not working properly, the elbow won't be, and the wrist and the hand, and you can apply that anywhere you want in the body. So what is the core, Nate? And I get into this in my other videos, and it's like a topic I feel like I can just never nail down. You know, I'm always addressing it. So the neck flexors, rhomboids, abdominals, and the glutes are usually the weak ones on most people. Abdominals are a huge muscle too. So tightening all these muscles. A lot of people they're lazy, I've noticed, or they're overactive. That's when they're throwing their head back, throwing their hips forward. It's like they're like an automaton, you know, all tight. You know, and that's not the idea either. It's conscious contraction of the core muscles. So it's not rigid, but it's not sloppy. It's right in the middle. It's a lengthening, if you want to think about that. You'll notice your lungs will open up, your head will drop over your shoulders, and it should feel natural, not all stiff and rigid. Here's a side view. Like I said before, the girl on the right, she's kind of throwing her head back. She's really rigid. She'll get a lot of pain in the back here because these muscles are just super tight. You can see how the butt kind of rises up. In this one, she's able to tuck that down a little bit. And you know, she's got a lot of structural problems. But this is definitely the goal for her, is contraction of those upper abs, kind of tucking that tailbone underneath her and kind of trying to rebalance her curves. But she's got a long way to go. Her head's still forward, front of the shoulder. You see how the shoulder's internally rotated. She's got some work to do. Strengthening the back, of course. And she looks like she's got the tight quads. So what would she be? What is this posture? Looks like anterior pelvic tilt. They're tilting forward. She's throwing the head back. She's trying to cheat. The eyes aren't level at all. Trying too hard, right? So every cell, organ, and tissue is controlled by your nervous system. Since your spine protects it, spinal column protects it, wouldn't it be a good idea to keep it aligned? Because you don't want this guy right here. Disc herniation pressing on the nerve, or disc height crushing the nerve, or just an improper curve forward or backwards. You know, because anterior pelvic tilts down the lumbars here, it's going to cause the curve to increase forward. Posterior pelvic tilt is going to do the opposite. Either way, it's not in the middle, it's not going to be happy. So get your spine checked and figure out what exercises are right for you. Figure out your posture type. Figure out what you got to do to battle against life. You know, life, a lot of times, life does us in, so we got to learn how to counteract it. You know, doing simple things got us into trouble. Doing simple things will get us out of trouble, unless it's a big injury. So please visit me on Klein Chiropractic Clinic on YouTube for more presentations on posture and strengthening your spine. The idea is not to give you a bunch of convoluted, strange exercises that are going to confuse you even more. It's just trying to get you to understand what is the best way to do an exercise. There's a lot of exercises out there are good. They're great. A lot of exercises your PT gave you are good and great. It's just how are you doing them? That's what we're trying to get down to, get to the bottom of. And yes, there are exercises that are not good for your posture type. So I'm not saying that all exercises are created equal. But it's more important about is form. All right. Thanks for listening, guys. I hope you learned something. I hope I piqued your interest and you'll reach out and get some of these answers for you so you can have a happy, healthier life with less pain. Okay?